Hello, greetings. So just talk about the general post-operative nursing care. Yes. So the post-operative nursing care, basically this is nothing but the care that is given to a patient following an operation. Yes. So this care basically starts from the time the patient is collected from the operation theater until discharge. The important headings that you need to mention under this care includes aims, patient collection, environment, position, maintaining airway, maintaining adequate breathing, maintaining adequate circulation, observations, pain management, nutrition, wound care, exercise, and finally elimination. These are the headings that you have to mention in your post-operative nursing care. So the post-operative nursing care starts with the aims. So the first aim is to protect the patient from injury. Yes. The second aim is to maintain the patient's nutritional status. Yes. The last aim is to prevent possible complications. Complications such as infections, wound gapping, or maybe pneumonia. Yes. From there, talk about patient collection. Yes, talk about patient collection. So as soon as you receive the phone call that the patient is ready for collection, make sure that you carry your post-operative tray. Yes, so that post-operative tray should contain the gauze, the thermometer, even the BP machine. Yes, all these equipment basically are carried for what? For assessment. It is very important that you assess the patient before collecting him. Yes, because you may end up collecting the patient who is what? Who is dead. Yes, so make sure that the patient is breathing before you collect that particular patient. Assess the incisional site for what? For any bleeding. Yes, before collecting the patient. From there, talk about environment. So under environment, talk about a clean environment. Talk about a well ventilated environment. Talk about a well lit environment. Talk about a quiet environment. Talk about an environment that contains all the resuscitative equipment in case the condition of the patient changes. Yes. Then from there, head to positioning. Yes. So the position of the patient will always depend with the type of operation that has been performed. So the position adopted, it should be in such a way that it doesn't interfere with the or it doesn't affect the patency of the airway. Yes. So make sure that you position your patient in the same in the semi-prone position. Yes. Then from there, head to maintaining airway. So during the unconscious period, in cases where general anesthesia was used, the patient is basically placed in a semi-prone position or in a lateral position. and there should be no pillows under the what? The head. Yes. If there are any secretions, make sure that you suction them. That is basically done to promote what? Patency of the airway. Yes. After maintaining a patent airway, head to maintaining adequate breathing. So here, assess the breathing pattern of the patient, count the respirations, make sure that there is bilateral airflow to the what? To the lungs. Check the oxygen saturations. If the oxygen saturations they are below 95, please commence oxygen. Yes, mention that in your management. Yes, from there head to maintaining adequate what? Circulation. So under maintenance of adequate circulation, assess for any signs of shock, such as what? Low blood pressure. Yes. Assess for any signs of what? Dehydration. Yes. Give fluids such as normal saline or what? Lingers lactate, just to replace the lost what? Electrolytes. If there are any signs of anemia, you can commence BT. Yes, blood transfusion should what? Should be done. From maintaining adequate circulation, head to observations. Yes. So under observations, here talk about the vital signs. Yes. Talk about the temperature, the pulse, respirations, and also blood pressure. The vital signs, they're basically checked in order to assess if there are any deviations from normal. Assess the wound if it is what? Bleeding. Yes, you need to observe the wound for what? For bleeding. Yes. And assess the drainage if there is what? There is the catheter that is in what? In situ. Talk about that. So after observations, and it is very important to note that in observations, first of all, you need to start observing every what? Every 15 minutes. If you're just from collecting what? The patient. Do the vital signs after 15 minutes. Yes. Then after observations, we have what? Pain management. Yes, we have pain management. So under pain management, a strong analgesia is basically what? Prescribed. Yes. So meaning that we need to administer prescribed analgesia such as pethidine or what? Morphine. That is to relieve what? To relieve pain. Under pain management, patient positioning is also very important. Yes. A quiet environment is also important in what? In pain management, as this will help in promoting what? Patient rest. So make sure that you talk about that under pain management. Yes. Then from there, talk about fluids and what? Nutrition. So under fluids and nutrition, if the patient is coming from theater after a major operation, no oral fluid should what? Should be given until the bowel movements have been what? Restored. Yes, until peristaltic movements have been restored. So during that time, the patient will be on what? On IV fluids. Yes. So food is also restricted during the what? The vomiting period. Until about 6 hours after an operation, or until the bowel movement has been restored, or until the peristaltic movement have been what? Restored. That is when you can start giving oral foods. Yes. So once the patient starts eating, make sure that you give a well-balanced what? Meal. Yes. So the meal should contain the vitamins, just to boost the immunity, the proteins, as these will help in what? In wound healing. Talk about carbohydrates for energy. Yes. From there, talk about wound care. Yes. So the objective of wound care is that of ensuring that the wound remains what? Uninfected and firm. Yes. So during wound care, it is very important that you talk about aseptic techniques during what? Wound care. So meaning that make sure that you use sterile gloves when doing what? Wound care. Make sure that the instruments that you used are what? Are sterilized. That is to prevent what? Infections. Yes. The wound should always be dry. Yes. Then from there, talk about exercise. So exercise, you need to teach the patient about the deep breathing what? Exercises, that is to prevent what? Pneumonia. You also have to be doing some passive exercises on the what? On the patient. Yes, like lifting the limbs, that is to prevent what? Deep vein thrombosis. Yes. Then finally talk about elimination. So on elimination, you need to monitor the bowel movement. You need to monitor the fluid intake and output. Yes, those are the things that you need to talk about under elimination. Okay, so on that note, we come to the end